First test, so some extra shoulder tests, posterior apprehension tests. So you're going to keep them at 90 degrees. You're going to try to scoot them to the edge of the table just a little bit to this side. You're going to stabilize the scapula. And then you're going to push axial load down into the shoulder joint. And for this one, it's if they're apprehensive or you feel instability, like the shoulder posteriorly shifts a lot, it would be a sign of posterior instability at the shoulder. The other test that kind of is a bit of a progressive test from this would be a jerk test, where you would stabilize the shoulder, you would axial load the shoulder with movement into horizontal adduction and continuing to axial load. For this test, they would possibly feel a plunk or a pop, and then it's obviously a pain provocation test as well, and it's a test for labral tears. The other test lying down that we're going to do is called compression rotation or grind test. This is a slap tear test, and for this one what you're going to do is, again, you're going to keep them into this 90-degree angle, kind of where you start your apprehension test, and you're going to load the through the elbow, so axial load through the elbow, and you're going into external rotation while they're relaxed, keeping that load and internal rotation. And that is also a slap tear test, so it's looking for pain provocation test. Any more sitting down ones? No? Okay, so we're going to sit up for me. So for this next one, for the shoulder, for the empty can test that I taught you guys, typically you'd have them in a standing position with this, so let's actually stand. And you'd have them in abduction to 30 degrees, rotated down to the empty can, which is a supraspinatus pain test. I know we did this already, but just stay with me for it. So you're going to hold that position, don't let me push you down. Perfect. And for the full can part of the test, the second part of the test, they should have weakness on the empty can, so they should feel weakness there. And on this one, when you externally rotate, hold it, don't let me push you down, they should have less pain and less weakness and more strength. And that would be a positive sign on both tests for supraspinatus tear or strain. Apley's test. The Apley's test I taught you is not the one that I want you to do in the comp. I want you to do this Apley's test. So you're going to turn and face towards me. And for every test, I'm just showing one arm, but you should do bilateral comparison. So for this test, it's a 3-movement test where you're going to ask them to do 3 motions, and you're going to compare it to the other side. So you're going to go right hand to left shoulder. You're going to do right hand going behind and touching mid-back. And then you're going to do right hand behind underneath, so an internal rotation. And you're looking for pain-free movement, and can they do the movement bilaterally the same? So then you would do exactly the same on the left arm. Just go ahead and do the same on the left arm, left shoulder, left over to the mid-back, and then behind. And you're looking for, do they have any pain, but also is their range of motion the same or decreased? And if it's decreased, it would be a sign of GERD, which is glenohumeral internal rotation deficit disorder, GIRD. If you face the wall for me, so this is a Gerber liftoff test. This is a subscapular strain test. So you would have them in that bottom position here, and then you would ask them to lift off from their back. And even there, you can provide a little resistance. So say, don't let me push into your back. Perfect. And again, you would do it on the opposite side. And what you're looking for is, can they do the lift off at all? If they can't, it would be a positive sign for subscapularis strain or tear. And then, can they resist against any resistance? So is it bilaterally the same? And that is a subscapularis test or strain test. That's that one. Okay, elbow. I think those are all your shoulder tests that I missed. Elbow test. So we have valgus stress test. We have a moving valgus stress test and a valgus stress test. So I'm going to do the valgus and varus test first. So valgus test is about 25 degrees of elbow flexion. You're going to use your right arm on the right arm of the patient if you're testing the right arm, and left arm on the lateral side if you're doing a valgus stress test, because a valgus stress test is testing the UCL on the medial side. And I like to ask them to grab my forearm lightly, like really loosely, and I'm going to put my middle finger where the UCL band is, the main part of the UCL, and I'm just basically pushing into valgus there and looking for laxity or pain at the UCL. If we do a varus stress, we would actually flip our hands. I'm going to move my body like this, and we would do exactly the opposite, testing for the RCL, 25 degrees of flexion, and maybe come a little bit away there, and we would then try to torque into varus at the elbow, and you're looking for laxity or pain at the RCL ligament, and that's our varus and valgus test. Another valgus test for UCL is a moving valgus test. So I'm going to step this way just a little bit, but you can stay facing this way. Sorry. And you're going to put valgus tension on the elbow, but have them in this externally rotated and slightly abducted position. You're going to start out at about 70 degrees of elbow flexion, apply some valgus stress. I like to grab the thumb like this. So this is a moving valgus stress test. And then go into flexion while applying valgus. And you're going into about 120 degrees of flexion, back out to 70. And you're basically doing a few passes on this to see if they have pain and recreation of symptoms at the UCL, to see if it's a UCL ligament sprain or tear. Those are our valgus tests, elbows. The last valgus extension overload test is where we apply slight valgus to the elbow, but we drop them into extension, which again is a UCL sprain test, but it's also like an anterior capsular sprain test. So does it recreate their symptoms when we bounce them into extension? And this is a hyperextension test, but we believe is also known as a valgus extension overload test, testing for an anterior capsular sprain or a UCL sprain. Let me do one more line test. Sorry, one more line test. Go ahead and lie down. Oh, there's a ton of tests. So this is a posterior lateral rotary instability test. So it's called posterior lateral rotary instability test, pivot shift test. It's for elbow previous dislocation or posterior instability of the elbow. So what you're going to do is like keep them at 90 degrees here. You're going to kind of grab the arm and supinate the hand. Apply, so palm to the sky. You're going to apply some valgus stress to the elbow, and at the same time we are trying to create a posterior lateral rotary instability. So we're basically going from a flex position and we're kind of axial loading through the elbow into towards the elbow, and we're going from a flex position to an extended position. And as you flex and go back into extension, you should, if it's a positive sign, see a possible subluxation. So like almost like a flick and a crack and a pop, where the elbow subluxes and then goes back into its original position, and it would be a sign. So really what you're doing is supinating. You are axial loading in this direction and applying slight valgus force while going from a flex to an extended position, like that. I think I did that right. That's a posterior instability test for the elbow. Sorry, I'm gonna have you sit up one more time. Thank you. Okay. Epicondylitis. We have lateral epicondylitis, medial epicondylitis. You have two tests for each that we mainly do. So for lateral epicondylitis, you palpate the lateral epicondyle. And all of these are like manual muscle tests, really. But what you're going to do is you're going to have them rotate into pronation, and you're going to ask them to actively extend against resistance. So go ahead and extend. Boom. This is a tennis elbow test. Some people call it a tennis elbow test. You're palpating the lateral epicondyle. You're looking for weakness. Go ahead and do it one more time. And pain at where my thumb is at the lateral epicondyle, and it would be a sign of lateral epicondylitis or tennis elbow injury. And this test is called either the tennis elbow test or the Cozen's test, which is C-O-Z-E-N-S. The other lateral epicondyle test, which is known as the Mills test, would be going from a flex position to an elbow extended and a wrist flexed position while your thumb or finger is palpating the lateral epicondyle, and you're looking for pain again at the lateral epicondyle or just distal to it for lateral epicondylitis or tennis elbow. Medial epicondyle is obviously on this side where all your flexors originate, and for this you would do the exact opposite movement. So what you would do is go wrist flexion against active flexion, so go ahead and flex up while palpating the lateral epicondyle or just distal to it, and you're looking for pain provocation at those flexor tendons. Or you would then go ahead and go elbow extension to wrist extension, and you're looking for pain right where my middle finger is again, and that would be a positive sign for medial epicondylitis or golfer's elbow or little league elbow. The last two tests that we do for bicep tendon rupture, one test is a hook test where we're going to resist them going into supination. So I want you to let me take you there, but I'm going to give you some resistance. So push against my resistance, have them in slight external rotation, and then be strong, be strong, be strong, push against me. And then you're looking to hook the bicep tendon while you resist supination right here. And if you can find the hook of the bicep tendon, it's a sign that they don't have a distal bicep tendon rupture. But if you can't and they are unable to supinate against resistance and you cannot access the bicep tendon, distal bicep tendon, then it would be a sign of a bicep tendon rupture. The other one we do is we lay their arm in a slightly pronated position, and it's a musculotendinous squeeze test, like your Thompson test at the ankle for Achilles tendon, and you would go ahead and squeeze, and what should happen if the bicep tendon is intact is the arm should just slightly deviate into supination, like that. But if it doesn't, and the hand doesn't move at all, and there's no supination movement at all like this, then it would be a sign that the bicep tendon distally might be ruptured. The last test, I'm going to do is Tenel's sign. Tenel's sign is just a tap test for nerve impingement. The main area at the elbow you would do it is at the cubital tunnel area, right behind your lateral epicondyle, between that and your lepidon. And you'll just use 2 fingers to tap in that zone where your ulnar nerve goes through. And you're looking for recreation of nerve symptoms, so like numbness or tingling down the 4th and 5th digit, and irritation. You could also do it for the radial nerve, right here where your supinator muscle is, to see if it irritates your radial nerve, and possibly even for your median nerve where your pronator teres is. But basically, Tenel's sign is usually at the elbow used for ulnar nerve impingement. So if they say Tenel's test on your test, I would do it for an ulnar nerve cubital tunnel injury. And that is it.